it is still too early to make judgments on the missed opportunities, it appears that the recent shooting in Santa Barbara was in fact preventable. On ABC World News Tonight on the evening of May 24th, they reported that the alleged killer in the shooting spree had recently spoken with police at the urging of family. Alan Schiffman, the lawyer for the suspected gunman, said on that weekend that his family had called police several weeks prior over concerns about YouTube videos where the son had mused about murder and suicide. Mental health is no laughing matter in this country, and recently two separate bills, were introduced in the U.S. House of Representatives. One solution came from Congressman Rob Barber of Arizona, a former aide to former Representative Gabrielle Giffords. The Strengthening Mental Health in Our Communities Act of 2014 focuses on raising awareness of mental health issues. His bill seeks to renew a few old laws and also maximize access to treatment. Part of the solution is to create a new structure reporting to a new position, the White House Office of Mental Health Policy. It also still steers clear of major controversy, unlike a separate bill. It aims to make hospital care more accessible to seniors with mental illnesses by requiring Medicare to treat mental health issues like all hospitalizations. The other proposal came from Congressman Tim Murphy, a former psychologist. The Helping Families in Mental Health Crisis Act is a result of a year of research by Murphy and his team. The most controversial part of this bill is the ability of mental health courts to commit patients against their will to treatment, and the defunding of much of the Substance Abuse and Mental Health Services Administration, or SAMHSA. His bill also seeks to clarify federal law so doctors could more easily share information with patients and caregivers. And finally, all these changes would be reported and directly accountable to Congress with the creation of a new position, the Assistant Secretary for Mental Health and Substance Abuse Disorders within the Department of Health and Human Services. Additionally, this bill realizes that the awareness of mental health issues is already present in our society, and the focus must instead be on access to care and family support. The challenge with mental health is the recognized patchwork of programs and ineffective policies across government agencies. What we have seen in so many tragedies in this country has been a lack of the ability of families and friends to get help to those who need it most. Whatever comes from these efforts, we must solve the fundamental hole in policy and protection for all Americans.